Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our inhaler series for asthma. Asthma is one of the most common allergic diseases affecting both children and adults, and inhalers remain the cornerstone of treatment. They are widely used, well-studied, and proven to be both safe and effective. While I have previously covered nearly all FDA-approved biologic therapies for asthma, this series shifts our focus back to inhalers, introducing them one by one. In this episode, we are focusing on Qvar RediHaler, a breath-actuated inhaled corticosteroid designed for simplicity. No shaking, no priming, no spacer, and no routine washing required. It delivers extra fine particles that can reach both large and small airways, where inflammation occurs in asthma. It is approved for patients as young as 4 years old and comes in 2 strengths, with flexible dosing ranging from 80 to 640 micrograms per day, depending on age, prior therapy, and disease severity. In this video, I'll walk you through 5 key things you need to know about Qvar RediHaler. What it is, how it works, how to use it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Qvar RediHaler and who it's for? Qvar RediHaler contains Beclomethasone, an inhaled corticosteroid approved by the FDA as the maintenance treatment for the prevention and control of asthma in adults and children ages 4 years and older. The original Qvar metered dose inhaler was approved in September 2000 for patients 12 and older, with a later indication expansion in May 2002 to include children as young as 5. In August 2017, Qvar RediHaler was introduced as a breath-actuated version and extended use down to age 4, helping simplify inhaler technique and improve dose delivery. It is important to remember that Qvar RediHaler is not a rescue medication. It should not be used to treat acute breathing symptoms or asthma attacks. Instead, it is taken regularly to reduce airway inflammation, improve lung function, and lower the risk of flare-ups over time. Patients should always have a separate rescue inhaler available for quick relief when needed. Second, how does Qvar RediHaler work? Qvar RediHaler contains Beclomethasone, a corticosteroid that targets the underlying inflammation in asthma. Asthma is not just about narrow airways. It is also driven by ongoing inflammation. Corticosteroids work by calming that inflammation, reducing the activity of immune cells and inflammatory signals involved in both allergic and non-allergic asthma. Because Qvar RediHaler is delivered directly into the lungs, it acts where it's needed most, while overall exposure to the rest of the body remains low. It's also important to set expectations. The onset and degree of symptom relief can vary between patients. Some may notice symptom improvement within 24 hours, while others should see benefits within the first 1 to 2 weeks. Full benefit may take up to 3 to 4 weeks of therapy, and lung function usually improves within 1 to 4 weeks. Third, let's talk about dosing and how to take Qvar RediHaler. Qvar RediHaler is taken twice daily by oral inhalation, ideally about 12 hours apart at the same time each day. It comes in 2 strengths, 40 and 80 micrograms per inhalation. For patients 12 years and older who are not already using an inhaled corticosteroid, the recommended starting dose is 40 or 80 micrograms twice daily. For those switching from another inhaled corticosteroid, the starting dose is based on the prior medication and asthma severity, ranging from 40 up to 320 micrograms twice daily. For patients who do not respond adequately after 2 weeks of therapy, the dosage may be increased under a doctor's guidance to provide additional asthma control. Patients should contact their physician if symptoms do not improve or worsen. The maximum recommended dose for patients 12 years and older is 320 micrograms twice daily. For children ages 4 to 11, the starting dose is 40 micrograms twice daily, with the option to increase to 80 micrograms twice daily if needed under a physician's guidance, which is also the maximum dose for this age group. If asthma symptoms do not improve or worsen despite treatment, patients should contact their healthcare provider to reassess and adjust the management plan. Once good control is achieved, the goal is to step down to the lowest effective dose to minimize potential side effects. Finally, proper inhaler technique is essential. Using the device correctly ensures the medication reaches the lungs and provides full benefit. Detailed instructions are available in the instructions for use section of the package insert and on the official website. Fourth, let's review important warnings and precautions. Hypersensitivity reactions, including anaphylaxis, may occur with Qvar RediHaler. If symptoms such as trouble breathing, skin rash or hives, or swelling of the face, lip, and tongue occur, stop the medication immediately and seek emergency medical care. Sudden worsening of breathing, coughing, and wheezing, known as paradoxical bronchospasm, can occur with inhaled medications. If this happens after using Qvar RediHaler, treat it right away with a rescue inhaler. Qvar RediHaler should be stopped immediately and alternative treatment should be used. Because Qvar RediHaler contains a corticosteroid, it may affect the immune system and increase the risk of infection. Contact your healthcare provider if you develop signs of infection, such as fever, chills, worsening fatigue, new pain, nausea, or vomiting. Patients should avoid exposure to contagious illnesses like chickenpox or measles and discuss any past infection or exposure with their doctor. Inhaled corticosteroids should be used with caution in people with current or past tuberculosis, untreated systemic fungal, bacterial, viral, or parasitic infections, or herpes infection of the eye. In addition, inhaled corticosteroids can cause a fungal infection in the mouth or throat, called thrush. Rinse your mouth with water and spit it out after using Qvar RediHaler to reduce this risk. If thrush develops, treatment may include antifungal therapy and temporarily stopping Qvar RediHaler. Using Qvar RediHaler at high doses or together with other steroid medicines for asthma, allergies, or skin conditions may increase the risk of systemic steroid effects, including hypercorticism and adrenal suppression. Patients should be checked for other steroid use and monitored for these effects, and treated if they occur. Long-term use of inhaled corticosteroids, like Beclomethasone, may contribute to the development or worsening of glaucoma and cataracts. Patients who develop eye symptoms or with a history of eye problems, including glaucoma and cataracts, should have regular eye exams while using Qvar RediHaler. Any new or worsening vision changes should be evaluated promptly. Prolonged use of inhaled corticosteroids may also lead to bone weakness. While the impact of small changes is unclear, people at higher risk, such as older adults, postmenopausal women, smokers, those with poor nutrition, limited mobility, a family history of osteoporosis, or long-term use of medications that cause bone thinning should be monitored for bone loss and treated if needed. Lastly, corticosteroid use may slow growth in children. Pediatric patients should be kept on the lowest effective dose needed to control symptoms, and growth should be monitored regularly during treatment with Qvar RediHaler. And finally, let's review the side effects and safety. In clinical trials of adults and adolescents ages 12 and older, using the 40 and 80 microgram strength of Qvar RediHaler, the most commonly reported side effects were oral thrush, pain or swelling in the nose and throat, sinus irritation, hay fever, and upper respiratory tract infections. In children ages 4 to 11, using Qvar RediHaler, the safety profile was generally similar to that seen in older patients. After approval, additional adverse events have been reported through post-marketing experience with Qvar RediHaler. Although it is difficult to determine how often these occur or whether they are directly caused by the medication, these reports highlight the importance of stopping the inhaler and consulting a healthcare provider if new, persistent, or worsening symptoms develop. And there you have it, 5 key things to know about Qvar RediHaler, a breath-actuated inhaled corticosteroid with extra fine particles that help reach both large and small airways, supporting better control of airway inflammation and long-term asthma management. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.